This condition you just watched is eclampsia. And when it comes to eclampsia, it's a condition that has to do with a woman having convulsions in pregnancy. This is so dangerous for the woman and also very dangerous for the baby. It's life threatening. And when it comes to this condition, it usually does not happen on its own. It usually follows a condition called preeclampsia. For many women who know what preeclampsia is, which is high blood pressure in pregnancy, you were never hypertensive, your blood pressure was never high, but all of a sudden you got pregnant, and from 20 weeks upward, the woman is now developing high blood pressure. That is what preeclampsia is. And if this high blood pressure is not properly managed, it can result to a woman having these convulsions in pregnancy. And when it comes to this high blood pressure suddenly develops in pregnancy, it's usually as a result of a problem in the placenta. And we all know what the placenta does. It also supplies the baby oxygen, supplies the baby nutrients. But if this placenta is having its own problems, it can result in a woman having hypertension in pregnancy. If an expectant mom and you're being told your blood pressure is high, and they did a urine test for you and they're discovering that you may have protein in your urine, whether it is 1 plus, 2 plus, or 3 plus, or however the case may be, it is important you are monitored closely by your doctors. When it comes to preeclampsia in pregnancy, it can happen on its own, but sometimes some risk factors that may make a woman develop hypertension in pregnancy. For instance, if you are younger than 20 years and you're pregnant, or you are above 40 years and you're pregnant, the risk of having hypertension in pregnancy, which is preeclampsia, is there. Like I mentioned initially, preeclampsia is what causes convulsions, which you just saw in the video. So people at risk are those who are less than 20 years who are pregnant, or above 40 years who are pregnant, or if you're having diabetes in pregnancy, if you've been told that you have a kidney disease, if you're on the big side, you're on the very big side. If you're pregnant with multiple babies, it could be twins, it could be triplets, quadruplets. If you're in this category I just mentioned, it's important your pregnancy is monitored closely. When it comes to pregnancy in general, always pay attention to your blood pressure. There are cases a woman's blood pressure is high because she's not having symptoms. She just thinks everything is okay, she's fine. Whereas that pregnancy is at risk, her life is at risk, her baby is at risk. So when it comes to blood pressure, it is not something you should joke with whenever you go for your antenatal. So there are cases the woman's blood pressure is high and she's not even aware. So it's important you know your blood pressure per time. So when it comes to the symptoms, there are some symptoms a woman may experience. Sometimes, like I mentioned initially, there are some people that may never have any symptoms. There are some people that will just have one or two of these symptoms. Some people may have most of these symptoms, and it varies from individual to individual. That's why we always say that no two pregnancies are the same, no two pregnant women are the same. So always watch your body. If along the line you're always having headaches, you're having blurred vision, you're not seeing well, if you're having abdominal pain, it's important you do not ignore all of these symptoms. If your body is swollen, your face, your hands, if they are swollen in pregnancy, do not ignore these symptoms. If you're already experiencing any of these symptoms I mentioned, it's important you run to the hospital, that you're checked, evaluated, and properly managed. And if you've been told that you have preeclampsia, please do not joke with your pregnancy. Do not joke with your monitoring. Do not joke with your medications. Do not joke with your appointments. Do not joke with things you're being told during your antenatal. And do not joke with the options being presented to you when it comes to delivery of baby. Because when it comes to preeclampsia, the cure of preeclampsia and the cure of eclampsia, which is this woman having convulsion, is that the baby is delivered. So pay attention to these things you're being told whenever you go for your antenatal, and pay attention to your body all through your journey. I hope this video is helpful. So see you in the next one.